thanks for joining in. I'm excited to talk about our topic today on heart rate variability. Dr. Corinne, who's going to be our guest, she's a radiologist, so she's going to be here a little bit later because she's performing an operation right now, just about finishing. But before I kind of invite her on, I'm going to spend about 10 or 15 minutes just introducing the topic to you guys in a little more detail, what heart rate variability is, why it's important for your health. This is a topic that actually I kind of started researching about 3 years ago to learn more about stress and how it affects me beyond just exercise. And as we know, stress is coming from so many places right now. It's not necessarily a bad thing, but we just want to learn how to optimize it and how to make it work for our bodies. So without further ado, I'm going to get right into it. I got a little PowerPoint presentation for you. As always, I want to make this as interactive as possible. So if you have any questions, you want to interrupt me as I'm kind of going through this little PowerPoint, please feel free, whether you want to talk or just share something on the chat screen. All right, let's see here. Here we go. Okay, I got about 10 minutes to get through this, so I'm gonna blow through it real quick here. Let's see. Oops. Perfect. So foundations of HRV, or otherwise known as heart rate variability. So I'm going to just really quickly go through what it is, how to measure it, and then once Corinne comes on, we can get into a little more depth on the subject, so you'll be able to understand it. So first of all, really quick, what is heart rate variability? It's the variability of time in between each heartbeat. So it's not necessarily your heart rate, which we can say is 60 beats per minute. As a heart rate, your heart rate variability, as you can see by this little graph here, actually shows you the difference in time between each actual beat. Okay, and basically, generally speaking, the higher the variability you have, generally, the better your health is, measured in many different ways. That every beat is 1 second apart. To actually have variability, so different times in between heartbeats, is actually typically a good thing. So it got started, it was used by hospitals 20, 30 years ago, primarily with EKG and very expensive equipment to measure health in their patients, whether they were unhealthy, whether they were about to get sick, if they were at risk for heart attacks. That's how the technology got started. And then it moved on to elite athletes. So people who would train for 2 to 4 hours a day to measure whether they were overtraining, because of course exercise for the most part is good for you, but it is also a stress. So that's how HRV, heart rate variability, got started as a technology in the beginning. And it basically measures the regulation or balance of our autonomic nervous system, which by the name means that it's subconscious, right? We can't fully control it. So it's controlled by our autonomic nervous system, and it's divided into 2 divisions. So you can see here, your 2 divisions are your sympathetic and parasympathetic nervous system. So many of you might have heard of these already. You probably have, right? Your parasympathetic is more related to your rest and relaxed state, and your sympathetic is your fight or flight. So for example, you're walking on the street, you see this just dog without a leash pop out at you. Your heart rate starts to go up, the hairs on your body start to straighten out, and you get into this more stressed state. That fight or flight state is actually, it's an adaptation, and it's a good one to prepare our bodies for stress. So it's not to say that it's bad. What we want, though, is we want to maintain balance between the 2 systems. And so if you can look at this little graph here, sorry, I'm just going to make sure I got everyone in. Okay, great. So if you look at this little picture here, you're going to see what happens. So when we encounter a stress, whether good or bad, that sympathetic nervous system kicks in, our HRV, our heart rate variability, goes down. Same thing happens when we exercise, or HRV actually decreases. And usually the body adapts to that stress. However, what the issue is, if you just stay in the sympathetic zone or state, it can lead to chronic stress and or illness for the long term. So we want to make sure, again, we have a balance between this and our parasympathetic systems. Whereas our sympathetic is more associated with growth and repair. We're most likely to activate this when we're sleeping, when we're resting. And then, of course, when this system is activated, for example, when you meditate or do deep breathing, usually your HRV increases, and that leads to long-term resilience or increased performance. So HRV is what helps us identify imbalances between these two systems. And before we get into more of that, is we got to think about, well, what affects HRV, right? A whole ton of things. When you think about stress, it could be sleep, unhealthy diet, being in isolation, bad relationships, right? Lack of exercise, our environment, the weather, allergies. Like, there's so many things. That's why it's not always an easy cause and effect relationship that we need to think about. And it's more that when our sympathetic nervous system gets overactivated, that's usually what leads to that chronic stress. And of course, how we perceive stress is also important, right? How maybe I perceive public speaking, for example, is different than you, and that's going to cause a different stress response. Exercise the same way to different people. So there's a lot of factors here to think about. Again, why I got into this topic and why it was important to me, about 3 years ago, some of you know the story, I started Revive. I had young kids. And I was obviously, at the time, was under a lot of stress. And as a coach, as a fitness coach, my way of coaching people, of course, is, hey, make sure you exercise, right? Don't stop, even if you're stressed, like keep exercising, keep working out. Well, I did that. I kept pushing myself, and I almost kept pushing myself harder because I noticed that my fitness levels and my strength started to decrease. So of course I thought, okay, well, now I need to just work harder to get my gains back. And in the end, what happened was the opposite, of course. I was under all this stress and pressure. I try to work out harder and more often. And if you look at this little graph here, right, there's a zone of exercise where it gives us optimal benefits. And when our life stress combined with too much exercise, stress, or intensity goes together, some of the things that happen, our cortisol gets dysregulated, we get sick easier, we have leaky gut syndrome, which is a whole other topic. But at the same time, if we do nothing, if we're not working out at all, and we're under stress, for example, our immune system, right, function goes down. We don't have as much resistance to stress. We're not as resilient to all forms of stress in our circadian rhythms. So so HRV helps us kind of really find out what this optimal zone is for us right now in our current state. And everyone's going to be different. That's what makes this interesting is, depending on your age, your lifestyle factors, where your optimal state is going to be different. And that's the fun of this, is trying to figure out what that is, how much you should be exercising every day, every week. And so that kind of goes to why it's important. People with higher HRVs generally live longer. They're healthier with less risk of disease. And these people may also have greater cardiovascular fitness and, of course, be more resilient to stress. So I'm not going to get too detailed into this picture, but you can really just see here, from the right side is when you have higher adaptability and higher HRV, you notice all the things that happen, right? You have better physical performance, enhanced cognitive, you sleep better, better immune system, and then really the opposite when you have low adaptability or low HRV is that you get sick easier, you get easily tired, low spirit. And if any of you have gone through things like adrenal fatigue or symptoms like that before, really high cortisol, you'll notice you might have experienced this in the past, and that exercise hasn't really helped you get better. So important to understand these two parts and really find the best balance. So how to track HRV, some of you are already doing this. I know that is using the app. We have the Elite HRV app, 2.5-minute morning readings. at least 4 times a week, but when you start, I recommend you do this every day. Long-term data is best. So if you see this little graph on the right here, if you miss a day when you're doing this, you might miss a really important day. You know, for example, it might be easier to take your HRV when you're feeling better, but it's actually probably more impactful when you take it after you've had a stressful day. So you do this in the morning to kind of help measure your stress from the previous day or even week. And as little as 150 minutes a week can help you make dramatic changes in your HRV. And it's a great tool for behavior change too. So we know that we need to exercise. Many of us may need to exercise more, but some of us may need to also do it less. And this is what kind of helps us really measure the balance of that. So good quote here: if it doesn't challenge you, it doesn't change you. You know, again, as humans, our bodies, we're built for stress, right? Think about, you know, people who've gone through the Holocaust or traveled to the moon and back. Like, our bodies are so amazing that we can adapt to a ton of stress. And many of the times, certain stresses, again, are good for us, but we want to make sure that we understand how it impacts us and learn that, you know, as much as we like to push on the gas, we also need to use the brakes. You know, I love that quote. So really trying to find the balance in everything is the key here. So that's my little talk. Again, some of you might know I'm doing a 21-day HRV challenge myself. That's on YouTube. So I'm recording my HRV scores every day for 21 days and then introducing you to it. So something I'm doing right now. And Corinne, I see you right there. Awesome. Thanks for joining, Corinne. I'm going to unmute you. So before I get started with Corinne, I just want to really quickly introduce Corinne, who's going to be talking to us about optimizing fitness and how she used HRV to train smarter. Quick intro here: that Corinne found a love for sports at university. Initially an antidote to all the studying, sports became a way of life. Through med school in Winnipeg, internship in Vancouver, and a 4-year diagnostic radiology residency in Toronto, Corinne was drawn to outdoor sports, be it running, biking, or swimming. Or better yet, something more adventurous like snowboarding or kitesurfing. She's now living and working in Calgary as a radiologist, and her drive for an active outdoor lifestyle has not diminished. And I'll add too that you know, she has a big desire to learn new things and a love of loves challenges. However, strength training was something that was hard for her to kind of get used to, and it wasn't a big draw, but I think she's starting to enjoy it a little bit more now. Would you say, Corinne? Just a little bit?
Absolutely, yeah.
Boy, that was a lot of talking, but again, thanks for being on. How's your day so far?
Good, yeah. Sorry, I have to apologize. I'm at work, so it's a little bit hectic in between, and I thought I could use my desktop computer, but although it works for video, it doesn't work for audio, so I'm on my iPhone. So hopefully this is good enough.
Oh, totally. Yeah, no, I can see you just fine, just fine. Yeah, so again, no, thanks for being here. You know, I think a lot of our members will relate to your story because I think about the people here are pretty avid fitness, you know, into fitness, love to train. Can you tell us a little bit about just your general background and you know, what got you into fitness?
Well, like you mentioned, you know, for me, fitness kind of became an antidote to all the studying and time I spent in the books, and I needed to get out. And I've always loved the outdoors. I grew up even in Winnipeg, you know, cross country skiing at 40 below, and you know, we would get outside no matter what, just to get fresh air and get some exercise. So, you know, I've always considered myself a pretty active person. I've loved to, you know, run, bike, swim. I've done a few marathons, a few triathlons. Yeah, and for me, you know, working out at Revive has been kind of a godsend in the winter in Calgary, because although maybe in the past I was running at 40 below, I don't do that anymore. So it's good to get some fitness in the winter at Revive Studio, and I've enjoyed I like the variety. I like, you know, being able to spin on the bike and do some strength training, because strength training has always been a weakness. Haven't really liked it, and but I'm definitely getting more into it now.
Awesome, awesome. Well, actually, and funny you say, I didn't realize this, but you've been with us for, because I know you travel a lot, but you've been with us for, I think, almost since we opened, like 2 or 3 years ago, right?
Yeah.
Yeah, that's fantastic, fantastic. Great. So yeah, you're doing a lot of the training, or you have done the training, and of course, you know, you're taking your HRV and everything now. Can you let us know kind of what got you into just using HRV, heart rate
Yeah, so
variability?
what happened to me is I had a serious health condition, illness last fall. I had to take about 2 months off work or more, and a month of that it was just pretty much flat in bed, and another month, you know, I was still on the couch most of the time. I mean, I was able to get up and do short walks, but I had a lot of chest pain. I had a lot of shortness of breath. You know, I couldn't work out. It was like the longest period in my adult life I've gone without working out. So, you know, following that, I started gradually was recovering, and by December, my blood work was all normal. So, you know, technically I should be normal, but I still wasn't feeling normal. And, you know, I was trying to get back into shapes, you know, trying to take it easy, but slowly get into fitness. And I just found it really hard. And, you know, I have an Apple Watch, and since I got ill, I was basically wearing it 24/7. I would follow my heart rate. And so I would see at night that it was higher than usual, or I would track my resting heart rate. But as I was recovering, I found that that wasn't helpful anymore. I kind of got to some sort of baseline, and it didn't help tell me, you know, when I was well, when I wasn't well, because I'd have good days where I felt energetic, and I had other days where I felt like crap. And I was like, what's going on? Why can't I get better? You know, I should be better by now. And partly it's just, you know, my type A personality. I want things to come along quickly, and I'm probably better as a physician than as a patient. So, so I started to search around for something else that could help me. And so, you know, I stumbled on this biometric heart rate variability, and, you know, my boyfriend encouraged me to check it out. So I thought, well, it looks pretty simple. I'll try it. So I've been using it now for 3 months, just taking my heart rate variability every day. And I found it's really helpful because I have a better, I'd say, sense of my body now. And I can tell in the morning when my heart rate variability is off. Sometimes it can be, you know, too far to the sympathetic side or too far to the parasympathetic side. And on those days, depending on how off I am, I either don't exercise at all, I just rest, or I do something simple or easy, go for a walk, or just a very easy bike ride. So, and using that heart rate variability thing to guide me, it helps guide my workouts, and when I have good days and bad days.
Totally. And before, you know, the illness started, how often, like how much would you say you were working out a day or a week? Like,
I probably worked out at least 5 or 6 days a week. And, you know,
mhm.
like literally before I got ill, the couple days beforehand, I rode my bike 65 kilometers. So, you know, I was quite active, but I think I pushed through some of my early symptoms, and I wasn't recognizing really how I was feeling and the underlying stress in my body. And I'm much more sensitive to that now.
Totally. And at the time, would you say there were a lot of other stressors coming in, like whether it was sleep or you know, like at the same time?
Yeah, you know, and some of that stress, I didn't recognize because,
Mm.
you know, my cholesterol's always been good. I tend to eat well. I usually sleep well. I'm active. I don't have a strong family history. So none of the usual things. But yeah, I mean, I think I had some stress in my life that was kind of building up gradually day by day, you know, kind of what I would call micro stress. And I'm an intense person, and I wasn't letting things go. Um, so
Yeah.
maybe that contributed to the illness.
Right. And you said you could notice like little things, little changes, but not enough to really like stop exercising, right?
Right. Yeah.
Yeah. Yeah. Um,
Well, yeah, that's not entirely true. I mean, I was getting episodes of chest pain off and on, and I did go to emergency a couple times, and
mm,
they tested me out, and everything was normal. So clearly there was something going on, and it took a while for it to manifest as kind of a full-blown, you know, serious illness.
yeah. And it's interesting how when these things happen, it can sometimes, like you said, like just, you know, blow open in a matter of a few days, but built up over a long period of time.
Yeah.
Right. Yeah. Um, with that, so you've taken, is it about, did it take about 3 months, or how many months did it take you to kind of feel semi kind of normal again, would you say?
Well, I was quite ill for about 2 months, and then 2 months, starting to get back to normal, but it's taken at least 6, 7 months to now feel close to normal.
Yeah.
And I'm still not, 100% where I was before I was sick, but I'm a lot better. And some things stronger, since I've been doing these weight training, strength training workouts, I'm actually stronger in some areas.
Yeah. Oh, fantastic. Fantastic. And for people who maybe aren't as familiar with HRV or just starting to use it, like how would you kind of help? I kind of talked about a little bit earlier, but like kind of defining stress, because HRV is great, but there are so many variables to think about. Like, how do you define sort of good and bad stress, and sort of what to look for when you're even checking your own HRV?
Well, the number doesn't distinguish necessarily between good and bad stress. It's just stress that has affected you. What I think is helpful is there's two things I look at. I look at my day-to-day number, and that tells me how I am at that moment.
Yeah.
But the other thing that's useful is looking at long-term trends. So sure, say I have a hard workout one day, and the next day my HRV score might be a little lower, but because I know I had a workout, I know there's a reason for it. And then hopefully I recover from that in the next 1 or 2 days. But there's been other times when, and I find this has happened more with mental stress, when I'm worried about something and I'm thinking about something for a day or two, I notice my heart rate variability going down, and it kind of stays down for a few days. And then to me, that's like an indication that I have to do something else. I need to be sensitive to what I'm feeling. I do some mindfulness. I just try to take stock through the day and just take some slow, deep breaths. The breathing out phase, I've learned, is really the important part of relaxing your body and activating your parasympathetic system. So yeah, I'm not sure if I answered that question directly.
No, yeah, it was a kind of a big question for sure. And so no, but you hit on one point, really great point there about kind of using deep breathing to help activate the parasympathetic side, because of course that relaxes the body. I looked at a graph of kind of how the balance is usually in a typical day, where we're mostly in sympathetic for most of the day when you actually take your HRV for a whole day, and then in sleep mode, you're in the parasympathetic, but you can do things like deep breathing to help shift that state in and around your day, right? Yeah. Have you used HRV in other ways to help really kind of like optimize your stress, whether with exercise or other ways?
Well, I guess sometimes when I've been through a lot of maybe physical stress, sometimes when I've worked out hard, I go into the sympathetic side, and then I flip over to the really high parasympathetic side. And when I'm in that red zone on the parasympathetic side, it means I'm in a deep recovery mode. And those are days when I don't do any exercise. I just rest. Just really, yeah. Learning how to chill has been more of a challenge than learning how to exercise.
It's so interesting. Yeah.
Yeah.
And I feel like, myself, very much the same, is learning how to take breaks is hard because of our personalities, right? Big time. So, and actually in a sec, because I know that we were going to talk about sharing some stats. So actually, I pulled my stats up, something we can maybe have a little fun with a little later and analyze together, because some people are doing this right now and tracking their own HRVs. But how do you feel just by improving our fitness can help us right now? Not just with HRV, but during COVID, like where are the benefits there, and just, exercise?
Well, I think that the HRV, you know, it is an indicator of stress. And so if you monitor every day, you can tell when you're happy, when your body is under a bit more stress, and, you know, and use some of those things like deep breathing and meditation to help you out. And, but still you want to exercise because that's important for your physical and mental health too. Just trying to figure out which days are optimal for exercising, which days maybe aren't as optimal for hard exercise, which days maybe you just want to go for a walk. And then, you know, if people are doing it, I encourage you to do it long term, because having done it over 3 months, you know, you'll see trends. I mean, I've seen that my resting heart rate now is coming down. And the other thing that's changed is, I think because I've been doing some of these harder workouts, I'm adapting more. So when I am stressing my body, I'm recovering faster and my fluctuations aren't as high. And so it changes a variable called coefficient of variation. So it's the percentage change in your HRV over a 7-day or 10-day period of time. So that has gone down. Like when I first started, it might have been like 15 to 20%, and now it's kind of more like 5, 6, 7%.
Yeah, totally. And I think this is why, like, being a doctor, you have a great understanding of physiology. I think with what you talked about, it can be hard for some people getting started just to kind of analyze and understand what all the numbers mean. But great point there about the coefficient. So what I'm going to do actually, and maybe we'll have some fun, we'll look at this together, is I'm going to share my coefficient, or all my stats here. Oh, actually, you know what? Sorry, I just saw this note. Sandrine asks, why is higher HRV, higher variability better? It sounds counterintuitive that having laps all over the place is a good thing. Yeah, let's start with that. Why is it better? What do you think, Corinne?
Well, a higher HRV on average, and we're talking about your baseline, right? Not the daily fluctuations, yeah. But if you do, you know, 10 readings in a row, higher heart rate variability means that your body is responding moment to moment, millisecond to millisecond, to all the input that your brain and nerves are sending to your heart. So they're sending all these messages to the electrical activity of your heart. At 1 second, you know, you need a little more blood flow here and a little more blood flow there. You're digesting, whatever. And so that variability means you're adapting in like microseconds at a time. When you're stressed, you can't adapt that quickly. So that's why higher is better than lower. And yeah, I agree. It's counterintuitive until you think it through.
Right. Yeah. That adaptability, I can't say that word today, is a huge point. And same reason why we exercise, right? Because, you know, our adaptability goes higher, and we can, you know, respond to more stress typically when we're fit. Yeah. Okay. So I'm going to share this with you here. We can have some fun with this and try to maybe, you know, analyze this together. But let me just give you my screen. So I've been, spoiler alert, with my 21-day challenge videos. I actually pre-recorded these like a couple weeks ago. So I have about 30 days almost now of HRV readings. And if you can all see this, yes, and back to Sandrine, yes, variability, sorry, is adaptation. That's a great way to put it, absolutely. So let's see here. Me and my wife are doing it, but you see, when you're the coach to your spouse, it doesn't always work as well. So she hasn't been taking hers as often. That's a whole nother subject. But anyways, so here's when I started. So my 21 days of kind of using HRV, what I've been doing was I've been doing a minimum of 30-minute workout every day. And I've been alternating between high intensity training or strength training. And then some days when my HRV score is low, I might just do like a low to moderate kind of 30-minute hour to an hour cardio session. So just kind of low and slow, we'll say. So Corinne, you can see this too?
Yes.
Perfect. Yeah. So here is like, since kind of when I started, I've got my scores, you know, a couple days in the green, then yellow, a couple days in the green, yellow. And then now I'm starting to steady out again a bit more in the green. But basically, I've been sticking to the same routine, one exercise, one workout every day. Did your scores kind of look like this when you started? Roughly?
No.
Okay.
When I started, I mean, I think I still had some underlying illness that I didn't realize. And so it's why I had those days where I felt like crap and other days where I felt good. So no, my first couple of weeks were like much more up and down. I didn't, really become steady till probably at least 6 weeks into using it and training with you. And yeah.
And partly because, like you said, you were sick and your body was still kind of adapting to everything we were doing, right?
Yeah, exactly.
Yeah, big time. The other thing, so this is my HRV, and I'll explain kind of my own thoughts of why it's kind of steadied out at green here in a second. But I'm going to add another, here's another one. We just talked about heart rate. So I'm going to get rid of all these graphs here. So I'll get rid of my HRV. So you'll kind of see too here is my resting heart rate in the morning is also steadied out a little bit more. So to kind of Corinne's point, I started doing my 21-day challenge here, working out every day, pretty good intensity. And there's a lot of variability in my resting heart rate. So it was a little bit on the higher side, we'll say, than normal. And then here is kind of what Corinne's point was about the parasympathetic activation. So if you look at these few days here, if I go back to my score, my readiness score, actually, no, I'll just stay here. My readiness score was actually kind of in more of a yellow state when I was, in these 3 days. And to Corinne's point, like my parasympathetic was kind of overactivated. So even though, I was kind of yellow and green, I could feel my body was in a state of deep recovery and I needed to relax a little bit more. So that was interesting, is that, my body kind of already was saying, okay, Mike, you're working on a lot, just try not to push as hard. So Corinne, I'm guessing you've had a few of these as well, where you've seen your resting heart rate drop for a few days?
Yeah, I mean, now I wish I knew how to share my screen because I can show you.
I know you've got more data than I do.
Yeah, I know. Let's see. How do I do? Is there a way I can share mine?
Let's see here.
Oh yeah, I can share content, right? No, that's much. If I'm not the organizer, I'm not sure how to share my screen.
You know what? I'm going to make you a host, and then let's see if you can share your screen then.
Yeah. Let's see. Okay, so what do I do?
I know this technology. Does it allow you to share it?
I'm not sure. No, it doesn't. I can send you a screenshot of a few things.
Sure, you can do that. And another good question. So are we saying that when we get a green score, we should take it easier that day? Typically, no. So it's when you get a yellow or a red score is usually saying that you want more of a rest day. And one more, actually, while we're on this, I'm going to show you one more stat here that's interesting, which was what Corinne was talking about, is your 7-day HRV CV, which is called coefficient of variation. So correct me if I'm wrong, but I think what this refers to is how variable, like how much your score changes from day to day or week to week, right? The percentage of change, Corinne, is that correct?
Sorry, I'm very bad at multitasking, as I've been told. And I'm just trying to text. Oh, I don't know if I can send you. Should I email it to you?
Yeah, email it to me.
Email it to me. Okay, that's probably the easiest.
Yeah, email it to me. And then as I kind of go through this, so what Corinne was talking about, so see this coefficient of variation here, this blue graph, is that as I kind of go through, it actually starts to decrease here, right? Under 5%. And usually when it's below 5%, so 5 right here, it's showing you that your body is adapting to a new normal. So it might be adapting to the type of workouts you're doing, or what, the type of training you're doing. So generally speaking, low coefficient of variation is good. When it isn't good is if it stays long for a really, really long period of time, because then sometimes that's an indication of chronic stress. So here we go. All right, Corinne, you've got way more data than I do. So this is really
I'll send you,
interesting.
there's one more that has my...
Yeah, wow, great. So do you want to talk about this real quick, how this kind of all came to be?
Yeah, so if you look, so the green and yellow and red are basically just an indication of your readiness. The one thing that's different about those things is that your baseline is constantly changing. So it updates your baseline from what I was reading, something like every 7 to 10 days. So it's good to drill down on some of the other data. So then, well, the next column down, you'll see the actual variability, the actual scores. So you can see what I was saying before. At first, when I started doing it, my variability was like really way up and way down.
Yeah, right here, yeah.
So you can see that over the last 3 months, I still have a few up and down days, but it's getting a lot steadier. So it just means that I think I'm both recovering more from my illness, and I'm also becoming fitter and more and adapting more to physical stress.
Yeah.
So that's the first one. I think I sent you a couple other
here's another one.
Snapshots. I sent a third one as well. So those titles are actually wrong. That next one is let's see here.
So yeah, your coefficient of variation right here.
Yeah, those titles actually go with the next one. The coefficient of variation is the red.
Oh,
so that was the one that I was telling you how the percentage of change, really I started off very high, around 20%. And then it's basically gone a little bit up and down, but you can see now I'm sort of, I've gone back up again this last week, but I've been more towards, 5-6%. So I'm adapting better. The column above that is the 7-day heart rate variability. So that's kind of your running average, which they use to calculate your running baseline.
Right.
And then I sent you one more picture on email, which just kind of shows my resting heart rate. It's gone back up again in the last week. I don't know if you have that picture. I sent a second email. But basically it's, I started off with my resting heart rate being around 60 to 65, and then it's basically dropped to around 50, 51, gone back up a little bit this week for some reason. So, yeah. So if you're into data, I find it really fascinating, but it's also interesting because, I've correlated it now more with how I'm feeling. And I don't think I was as sensitive to my body, those changes from day to day as I am now.
Yeah. So that's another good point, is you can't just use the score or the readiness score on its own. You really have to take the context of what you did and how you feel. And there's a lot of things to think about there, right?
Yeah.
Yeah. Okay. Awesome. So yeah, that's great. And then that part about your resting heart rate starting to steadily go down. I've noticed that in myself as well, actually. I slept it's funny, in the last 3 or 4 days, I've slept over 8 hours a day, which I don't normally do. And my body, I can just feel it a little more tired and needing that sleep. But in the past few days, I've actually felt a lot better, just sometimes knowing that my body needs that. Yeah, and I think my HRV scores have also been better because of it too. So all these factors to play in. Yeah. Yeah. So for you now, what is a perfect week in terms of exercise for you? What would that routine look like?
Yeah, I'd like to be able to work out 5 or 6 days a week like I used to. Yeah. And for me, it's always about variation, and I like getting outside. So now the weather's getting better, so I want to get out and start doing some longer bike rides. I'd like to get up to 60, 80 kilometers on some of my rides at least once a week, and still continue with some of the strength training.
Yeah.
And because I like how it's made me feel stronger. And I can notice now that certain things, like if I'm climbing hill climbing on a bike, or if I'm hiking, with that increased muscle strength, I feel like I can do those things better. So,
Perfect. And actually, a really quick point on that. How important do you think strength training is for you now, doing that? Because you weren't doing as much of it before, right?
yeah, I mean, I think it is important, and especially, as we get older, I'm getting older. I need to focus on maintaining muscle mass. One thing I realized when I was ill, I mean, I lost a lot of weight, but what really distressed me is, we all want to lose a few pounds of fat, but I lost a lot of muscle mass. I'd say my legs, like my thighs, which are normally really strong, they were half the size. So even just maintaining muscle mass in case you do get ill, it's important. Not to mention just day-to-day strength and being able to do, activities of daily living and keeping your bone density high. And yeah. And like the other thing that muscle mass I think is important for is the more muscle mass you have, the more at a cellular level you have more mitochondria, and that helps you with your aerobic metabolism.
Totally. And to define kind of how we do strength training, or how we kind of define it, is usually exercises, the 2 or 3 exercises in a row, but after each set is making sure you take at least 30 seconds to a minute rest, so that your nervous system and your body can recover enough by the time you're on your next set that you should be able to lift at least as much, if not more weight, right? So that's where it's a little different than HIIT training, high intensity interval, where you'll see in my videos that I post that, usually HIIT training is more continuous. So we might do like 7 minutes, 4 exercises, and you're just not stopping. Whereas the strength is more like focused, maybe 2, maybe 3 movements, heavier weight load, and then making sure you get that rest, which sometimes I know it's easy to forget. Or Corinne, I know you're eager to go, but that's so important for strength, that you take those recovery periods at rest, so that by your next set, your movement quality is high and you're able to lift more weight. Yeah. So thank you so much, Corinne.